So that's it. Thank you so much for listening. Do you have any questions?
Ay. So, thank you, sir. So, sobra pong laman ng inyong slides. Although, I'll be honest with you, sir, nung makita ko po na binasa ni Ma'am Elaine, so, it is only composed of 15 slides, sir. So, pag-iisipin natin 13 slides lang kasi yung last is thank you and yung una is the title part. Pero sobrang laman ng inyong slides. Kahit konting slides, parang talagang this is your expertise na explain nyo po ng ayos sa amin. Actually, nag-jot down talaga ako ng notes, sir, sa discussion nyo kasi natutuwa ako when it comes to formal, meron din tayong about the Bible, parang you know already nang paikot-ikot ng topic natin. So I also agree with you, sir, na that our brain has no on and off button na kapag sinabi nating off muna ang stress, ma-off agad, or kapag sinabi natin na on, ma-on din agad. And also, I believe that do not allow ourselves to be diagnosed by one of these mental health issues like stress, depression, and anxiety. So, sa lahat, sir, actually, may mga nag-raise na, sir, ng questions before. Pero, when we go around the topic, na-touch nyo na po yung mga questions ng mga bata. So, someone asked, how could an individual naturally cope up with the loss of loved ones? So, actually, hindi pa namin na itatanong sa inyo yung questions, pero sa discussion, sir, nasagot nyo na based dun sa gestalt therapy natin. So, you have been given us different examples of of those therapy kung saan siya pwede. So, sir, I have a question. So, sir, is it normal to feel a sudden anxiety because of too much work or schoolwork? So, is it normal for us teachers, as well as to our students? So, normal lang po ba siya? O talaga, sir, abnormal pag nakakaramdam tayo ng mga ganito?
Actually, it's part of life, so it's normal. You will be clinically diagnosed because we have these signs and symptoms. And one of the symptoms is we need to observe for weeks. For example, depression, you need to be in extreme sadness for like 6 months. For anxiety naman for 2 weeks na every day, excessive worriness talaga yung nararamdaman mo. So, you need to consult a psychologist. Pero kung, let's say, for example, ngayon, may anxiety ka, tomorrow wala na. So it's not a problem. Okay? It's normal. Pero kung every day um nagiging problem na siya for 2 weeks, it will be a problem. Plus, it has a deficient or it has hampering effect. Hindi ka na nakakapag-perform with your normal task, then that's affecting you as a normal person. Hindi ka na nakakaligo, hindi ka na nakaka-toothbrush, hindi ka na nakakakain, yung normal na task mo hindi mo na nagagawa. So that will be now characterized as a disorder.
So, sir, sa tingin nyo, what would be the best step muna? So, since halimbawa po katulad ng mga students, hindi agad makakapag-consult dun sa mga doctor, katulad po ninyo. So, what would be the best advice that you can give us? Sa halimbawa po sa amin lang, sa bahay lang, what we could have done para po maiwasan namin tong mga ganito?
Okay. Again, you need to express your thoughts and emotion, your frustration. Sumigaw ka kung gusto mong sumigaw, umiyak ka, magwala ka, maghagis ka ng plato kung kinakailangan, just for you to relieve your emotions. Kung may makakausap ka na mag-absorb ng mga negative emotions mo, maybe get your best friend or maybe call your friend just for you to, to express what you think and what you feel.
Okay, sir. Thank you po. So, ibig sabihin po, so, the key is to express yourself, sir.
Yes.
Okay, sir?
Mhm.
So, thank you po. So, I'll be, sir, handling the questions from our chat box. So, one of the questions here, lang po. Wait lang, sir. Pili po tayo ng mga tanong dito sa ating chat box. So, eto, sir. So this is coming from the participants of our webinar. So these are the questions. Yan. So the questions are coming from different platforms, sir. So babasahin ko po. So there are lots of misconceptions or myths around there. So thank you for all the clarifications. But these are the questions. So do talk therapies or cognitive behavioral therapy work all the time?
Okay. Um, there is no one size fit at all. Hindi lahat ng therapy ay magma-match sa lahat ng mga patients or sa clients. There are some clients who are in denial stage. But yung family member yung nag-seek ng help. So cognitive behavioral therapy, kung hindi sila magpa-participate with the sessions, so what we do is we seek for psychiatrists to like have an IV therapy or medications if their mental illness is very severe. Now, there are also some sort of trauma that has not been addressed by CBT, cognitive behavioral therapy. So, hindi lahat ng trauma, for example, post-traumatic stress disorder ng mga police or ng mga military personnel, hindi usually umi-effect ang CBT, cognitive behavioral therapy. So, ibang therapy yung pwede sa kanila.
Okay, sir. Thank you, sir. So, the next question, siguro naman po ay nasagot na. Is it better than taking medicines? Just like what Doc Ryan says, one size does not fit all. So, pwedeng mas okay sa kanya yung cognitive behavioral therapy, pero hindi siya okay dun sa taking medicines. So, the next question, sir, is, so will the cost of the therapy stress me more than make me feel better? So, mahal po ba magpa-therapy when it comes sa gantong therapy po natin?
Okay. In our clinic, we charge just 1,000 pesos kasi. And then, it's for the consultation, including the psychological test, meeting the two doctors. So, in our clinic, in our practice,
Yes,
it's
sir.
1,000. So, but, you know, therapy, pag inisip kasi nating therapy, we always think na kailangan very professional yung mag-handle. But as an educator, as a teacher, we are doing therapy but hindi lang tayo aware na yung technique pala ng Gestalt ginagawa na pala natin. Yung existential therapy for advising yung ating student na what's your purpose in life, ginagawa na pala natin siya. Right? So, it's not just always going to the clinic, going to the psychologist. First thing is you need to go with the person that you're really comfortable talking with. Then kapag hindi na kaya nung taon yon, so I recommend saka pumunta ng clinic or ng therapy.
Okay, sir. So, malinaw naman po sa lahat. So, it costs, sir, 1,000 per session po yon sa kapag ganitong mga therapy. Okay.
Opo.
Sa assessment part, sir, di ba po kapag ganitong mga therapy, meron pa po mga assessment, evaluation, kung asang ano na po yung patient natin. 1,000 din po yun, sir?
Inclusive of the package po yon. Pero merong mga psychologists na ang charge nila is 1,500, 2,000. So it depends sa geographical location.
So, sir, kasi po ako, nagpapa-therapy po ako ng anak. So, dati po kasi mas mura. So, yung po bang 1,000 is nito lang nag-pandemic or mas mababa po siya before the pandemic? Kasi yung sa anak ko po, mas tumaas ngayong pandemic. Kasi daw po because of safety purposes, kaya po tumaas. So, yung 1,000 po ba ay ngayon lang or mas mababa po siya dati?
Actually, noon pa ganito yung mga charge namin. But depende sa therapy. Pag may kasamang occupational therapy, rehabilitative therapy, pag may mga ganong kasama kasi yung packages, nag-rise yung price or amount. Pero kapag ordinary therapy consultation lang, it's 1,000 pesos. Like your test and then consulting the two doctors. Sa amin kasi first doctor is the first doctor will explain what you are currently experiencing. The second doctor is the one who will recommend kung anong therapy yung babagay sa'yo or magkakandak din siya ng therapy for you. Pero kapag sinabi ng second doctor na you need to progress to the next doctor, example is the neurologist, yung brain mo titignan, or kailangan mo ng occupational therapist, ano pa ba, lifespan intervention therapist. So, tumataas yung price. Pero kapag hanggang second doctor ka lang, for our practice in perpetual din yan, our charge is only 1,000. Pero pag nag-progress pa at marami pang consulting doctors, nagmamahal na siya.
Okay po. So thank you, sir. So another question, sir, from our participants. So can you give us some advice on how to stop the flow of negative thoughts since there is no switch off on our brain?
Ayan. My expertise is natural healing. We need to use our environment. Kasi, for example, ang anxiety, it is because we have low GABA. GABA is a brain chemical or neurotransmitter. And in depression naman, serotonin, mababa yung serotonin na brain chemical. For us to increase those, we need to stop drinking soda, soft drinks. We need to stop drinking caffeine. We need to have a really good quality of oxygen. So, one of the plants is snake plant. Itong nasa likod ko, yan. Meron siyang really good quality of oxygen na nagpapataas ng serotonin at GABA para yung anxiety and depression ay mawala. So remember that 80% of the oxygen is being consumed by the brain. Kaya kailangan pakainin natin siya ng a really strong oxygen ang brain. Another thing is we need to eliminate cholesterol kasi nagiging meatball siya going to the brain, and we really need to have a high HDA, high folic acid, especially yung mga nasa tuna, yung mga fish oil, nuts, yun yung mga pampataas ng mga brain chemical para mawalan anxiety and depression natin. Another thing is the sunlight. It has a really good source of vitamin D na nakakatulong para sa pag-process at pagtaas ng GABA and serotonin. And also the negative ions. Negative ions are negatively charged particles na makikita natin o mafe-feel natin sa rainforest, sa oceans. Kaya kapag magbe-beach tayo, it's very relaxing, right? It's because of the negative ions na nalalanghap natin.
So thank you, sir. So mali pala po ang ginagawa ko. Pagpakiramdam ko po kasi na sobrang stress ako sa school na ang dami-daming ginagawa. Ang ginagawa ko po, minom ako ng soda, ng soft drinks.
Ay, hindi.
Pag nakainom ako, sir, parang pakiramdam ko ay iba-iba. Kaso bawal po pala yun at saka yung mga caffeine. Yung coffee, minsan po, stress, akala ko pang tanggal din ng stress, kape muna ako, sakit kasi ulo ko. Kaso, hindi pala siya nakakapag-contribute to lessen the negative thoughts. So, thank you, sir, for that very sobra palang mali yung ginagawa ko. So, I question another, sir, from our participants. So, what do you think about online chat sessions with friends? Is it as effective or less effective or very much less effective than talking with friends or peers in persons?
Okay. I read the study for Stanford University. It's only effective for 15% because our brain is suggesting for us to express our emotions and feelings using our vocals. The more that we use our mouth, our vocals in expressing our negative thoughts and emotions, the more that we express the negative things or the thoughts and the emotions. But when we're just typing, our vocals are closed. Hindi tayo nagsasalita. Finger lang yung... What we are just only expressing is our thoughts. Kaya less effective yung chatting na expression.
Okay, sir. Thank you po. So, I agree with sir siguro mas okay yung kaharap natin, yung kakausapin natin than merely chatting. Actually, sir, I've experienced that. Siguro po, marami akong nababasa sa Facebook. So, I have a postpartum depression nung after ko po manganak. So, I feel,
Mhm.
sabi ko dun sa best friend ko, best parang naluluka ako. Wala naman kaming problema, pero iba yung pakiramdam ko. Minsan po naiyak na lang ako sa gabi. Sabi ko, ala, luluka na ata ako. What my best friend was told me. So I think one of the best medicines, sir, is praying. So bago ko matulog talaga, I already make sure na nakapagdasal ako at least
Yeah.
kahit papano sa kanya ko inihihinga na so Lord, bakit ganito? Okay naman kami, wala naman kaming problema. Pero iba yung kiramdam ko, iba siguro po dala nga lang din nung after ko manganak. Pero minsan sir, kanyang talaga po bang pinagdadaanan niyo ng lahat yung postpartum depression ng mga nagbuntis or hindi naman lahat?
Yes po, kasi 'pag nagbuntis ang isang nanay, um, the internal organs and the internal body also shifted their normal process, especially the brain. Iba na yung process ng brain. Yung serotonin bumababa kapag buntis. So nagiging depressed up until 2 years bago makapag-cope up, bago tumaas ulit yung serotonin. Kaya ang postpartum depression could take at least 2 years. So what I recommend, ma'am, is search in Google for foods na pampataas ng serotonin, and yun yung lagi niyong kainin. May mga foods na pampataas ng serotonin po. I-search niyo po sa
Okay.
Google.
Sige sir, pag halimbawa po manak po ulit ako, I'll do that.
Sige po.
Thank you, sir. Thank you, sir, for the advice. So, sir, ari po ay medyo mahaba ang tanong ng one of our participants. So, gusto niyo po ba ako na lang, sir, ang bumasa?
Yes
Or
po,
you want...
ma'am. Ay, nasa po
Okay
dito.
po, sige. Sa chat box po natin, sir.
Ay, ito po. This one is very long. Sige po, ma'am. Basahin niyo po, ma'am.
Okay po. So, this one is very long. Okay, please read the entire questions posted as multiple messages. Okay. Based on what you have discussed, I am somewhat of a loss with those gestalt, existential, and client-centered therapy. So the example you gave with gestalt therapy techniques has something to do with coping as using crying. That's one of the examples I can relate to since I am just an ordinary person. Also, teachers can initiate talk therapy sessions with students. But how about students like me? Suppose I have initiated a talk with a teacher of my subject I am having some problems with. Thus, I consider my teacher as a stressor. So my question to be considered collectively are, what are the red flags that I should look for so that I can stop talking with the teacher? I am talking about when I should when should I stop talking with the teacher? How do I know whether the teacher is not up to the task talking regarding my problems? Do I really have no choice but to talk to the teacher even if he or she is somehow does not know any talk therapy strategies?
Okay. So, of course, every teacher has different personalities and different attitudes. But you know to yourself if your teacher can be a great help for you. Okay. So if you just want to express and you want to relieve your emotion, it's not always the go-to person is the teacher. Maybe you could go to your friends if you just want to express and relieve your emotion. Okay. Now let's go with the teacher as the stressor. And according with digital therapy, so we need to live with the reality, accept it. Okay, my teacher is my stressor. So what you will do now, okay? So again, acceptance is the key. Once you accept that the teacher is your stressor, what you need to do next, okay? So maybe your teacher is becoming stress. a stressor because there are a lot of things na gusto niyang ipagawa sa'yo, right? So, para matapos ang stress mo, edi gawin mo na nga yung mga pinapagawa ng teacher. And of course, try not to be also a stressor sa teacher. Baka naman 'pag nagme-message ka dun sa teacher pagkahaba-haba, maya't-maya ka na nagme-message, nai-stress din tuloy si teacher. Nagiging stressor kayong dalawa. Okay? Try to be polite as much as possible and try to be really courteous and nice to your teacher. Huwag kayong message ng message tuwing gabi, tuwing Saturday or Sunday, pag rest day ng teacher kasi nai-stress din sila sa inyo or nagiging part ng stressor. So, in return, nagiging toxic din siya sa'yo. Nagiging toxic ka sa kanya, nagiging toxic din siya sa'yo. Okay? Kung mga task naman ang pinag-uusapan, so you need to live in the reality that you are a student and you need to finish the task on time. If you're having a problem with deadline, I think you just need to manage your time. Okay? And you just need to live with it. Okay?
Okay, thank you again, sir. So, you have questions pa po. So, I think naitanong na nga po natin yung sa another question natin. So, ayan po, meron pa, sir. So, this is the part when you talk about client-centered therapy. If I try to sort of counsel one of my peers, would I absorb a lot of negative energies that at the end of our talk, I will end up stressed more than my friend? Because I have absorbed some of his negative energies, how can I prevent this? So can you mention some of the techniques of throwing away some of the negative energies that I have absorbed? Or should I just ignore my peers who brings problems to me so I can protect my mental health?
Okay. Yeah, I'm gonna question yan, ma'am. Like what mentioned earlier, ito yung hindi ko usually recommend sa isang therapist because it's being done by an expert. Kasi if you're not really trained enough to absorb negative energy, after those sessions and after you talk with them, there's an unexplainable feeling na ba't parang ang bigat ng pakiramdam ko? Kinausap ko lang naman tong ganitong tao, di ba? So, usually, you became affected with those negative vibes, with their problem, nadadala mo siya hanggang bahay, napapagbuntunan mo yung family mo because of that. So, as a resolution, number one, kung hindi siya i-effect sa'yo as a therapy for your friend, maybe try different therapy as a counselor para doon sa friend mo. And if you really like this, maybe one of the step is for you to really understand that you are really a sponge. When you accept this kind of negative energy and negative emotion, you need to express it as well. Kailangan mo din siya i-express kasi na-absorb mo siya, pero kailangan mo siyang itapon. I-express mo siya, pero not to the point na, for example, may sinabi siya sa'yo na problema niya, then isi-share mo sa katrabaho mo din, what will happen is parang you're creating a chismis. Okay? Hindi ka pwedeng mag-share doon sa meron kayong common sa circle ninyo. You need to express those problems maybe sa asawa mo or maybe sa partner mo para you could ensure na nakapag-express ka, na-absorb ka ng negative energy, na-express mo din yung negative energy, and then you are not creating chismis. So, yun po.
Ay, thank you po, sir. Sobrang, sir, sarap makipituhan sa inyo. Talagang natural po ang ating mga sagot. So, I think, eto po, I'll be having our last question. So, teacher and a student is unloading his or her problems to me. But I feel that I am not capable of advising him or her. What can I say to these students to ease their problems at the same time not add to my stress?
Okay. Number one key is to be just a good listener. As a student, they just want to feel someone na may makikinig sa kanila. Just be a good listener. If you don't want to add stress with your students, so maybe while they are talking, play background music with you, mahina lang, para hindi ka talaga 100% focus doon sa student na yon. You will sound very plastic here, but you're also because there are also some teachers who's very weak ang personality and they cannot absorb yung mga negative energy na ito. But you are just trying your best to be a good listener, pero ayaw mo i-absorb lahat. Then, I suggest that 50% of your concentration and focus lamang ang ibigay mo. What important is um, you're responsible and ginawa mo yung trabaho mo as a listener. You just listen. Then, magpatugtog ka ng medyo mahinang sound para yung focus mo ay mahati. 50% sa student and then 50% sa music para hindi ka masyado maapektuhan.
Galing naman, sir. Hindi pala yun. So, pwedeng naman na talaga. So, you're a good listener, pero hindi lang doon yung focus mo. Pwede nga pala yung 50-50. Kaya minsan yung nagtuturo ka, at the same time, may iba ka rin. Okay, sir. Thank you, sir. Pwede nga pala yan. So, para hindi natin ma-absorb yung lahat ng negative vibes, so, although we can also be considered as good listener, pero our focus is not 100%. Okay, thank you, sir. So, it looks like we've covered all the most important questions.